All right, so welcome everyone. My name is Elizabeth Roldan. I'm here with Julie Servideo from IMAC Insurance. We are the insurance broker for the district. We're here to talk about the 2024 open enrollment, as well as your medical plan being moved over to Horizon, which is very exciting. We're here to answer any questions that you may have regarding the transition, as well as any open enrollment questions. But we also do like to remind everyone that we are your insurance claim advocates as well. So if you have a claim problem regarding your medical, prescription, or dental, certainly feel free to reach out to us directly at 973-450-9800 or via email at info@imacagency.com, and we will get back to you. I know that I'm getting back to people even at night because I know time is running out with open enrollment. So we want to make sure that everyone has enough time to make a decision of what they want to be in come January 1st. So with that said, Mahwah Township Public Schools will be transitioning its current medical plan from the state health benefits to Horizon Blue Cross Blue Shield on a direct basis, effective January 1st of 2025. You are in an open enrollment period now. That period has started October 15th and will be running through November 15th. That is a hard deadline. So any plan changes that you're considering, please make sure that you have them submitted by that Friday, November 15th. The plans that are provided from Horizon are equal to or better than your current benefits, and they actually include some benefit enhancements. We have all the comparisons currently on the IMAC benefits portal, which we are going to be referencing quite a bit. So if you haven't visited the portal yet, I highly suggest that you do. You'll see some incredibly great information that was put together to make sure that you have everything in front of you that you may need regarding the change. Open enrollment is your annual opportunity, I should say, to review your plan options and make any plan changes. Your prescription and dental benefits are staying exactly the same, so no change there. If you waive your coverage, though, you must complete a waiver form, and that's an annual thing that I know you've been doing already. During this open enrollment and transition to Horizon, the same 4 plans that you have currently are going to be offered. So that's your Direct 10, your Direct Access 15, the New Jersey Educators Health Plan, or NJEHP, and the Garden State Health Plan. The same restrictions as far as employees that were hired after July, and I know it says January, but it really should be July 1st of 2020, you are required to be in the New Jersey Educators Health Plan or the Garden State Health Plan until 2028. But again, if you are someone that was hired before July 1st of 2020, you can elect from any of the 4 plans that are being offered during open enrollment. If you currently have a dependent that is overage that participates in the Dependent 31 or Chapter 375 coverage for medical, they will need to re-enroll with Horizon. We have the form on the IMAC benefits portal currently. I highly recommend that if you have a question about this, that you reach out to us, because you will need to have that dependent that's currently enrolled that is overaged re-enroll with Horizon. We do have a slide coming up specifically about what Dependent 31 coverage is, which may apply to some people that have never considered it or looked into it previously. Also, if you have a special needs, handicapped or disabled dependent, you will need to complete a new continuation form for them as well, now that the district is moving back to Horizon on a direct basis. We do have those, we have some forms on the portal, but we definitely would want to make sure that we talk to you, because we want to make sure that that transition is also very smooth and that everything is processed and enrolled correctly. Please note that we are encouraging you to log into Benefit Solver and review your current enrollment information to make sure that it's accurate, because in Benefit Solver, we're going to be using most of that information in there as part of the transition to Horizon. So if your information is updated on Benefit Solver, please, you don't have to go ahead and make any changes, but please make sure that you double check that. And also, if you are going to be making a change, I think we were saying this at the top of the meeting, please make sure that you either make it on Benefit Solver by November 1st, by October 31st, excuse me, or if you are going to be filling out a form, that form needs to be sent to Nicole by November 15th. So you can make your changes on Benefit Solver by October 31st or on the form by November 15th, whichever, but that final deadline would be November 15th. All employees in the district will be getting new ID cards for their medical. Your dependents will not be listed on there. It'll just say your name and your coverage tier. So if you have a spouse and dependent children, it'll say family next to your name. So just please make sure that when you receive your ID card that you take a look at it, make sure that your information is correct on there, that the correct plan is listed on there as well. And probably the most important takeaway for today is to make sure that you present that new ID card at your doctor's offices come January 1st. We see this every single year during the month of January and during the month of July when districts also have open enrollment in certain districts or townships, that the number one issue for members is that their claims aren't processed correctly because they don't present their updated card. If you're going to be having a procedure, I would highly recommend that once you get your card, if you're having a procedure, especially right after the new year, I would highly encourage you to make sure you provide that information in December to your doctor. But definitely any services that you are having rendered after January 1st, please make sure that you're presenting that new ID card. On or after January 1st, you can actually go into horizonblue.com, create a user account, and print a temporary card if you need to, or have a digital copy of it saved on your computer. There's also a lot of great money-saving tools for Horizon members that are in that member portal for Horizon. You can also take a look at your explanation of benefits through there. So I would highly encourage everyone to make sure that after you're active in the system on January 1st, that you go ahead and you also log into Horizon to create and register your member account. For those of you, and I think this was a great segue into this, for those of you that have procedures that are already in place with prior authorizations that are happening after January 1st, please make sure that you reach out to our office. We'll get those procedures that are already approved and pre-authorizations that are in place. We'll get those moved over behind the scenes for you, but we need to know about them. So it's important if you're in Direct 10, Direct 15, or the educators plan currently that you let us know and we can have those prior authorizations moved over for you. If you are someone, however, that is in the Aetna Garden State Health Plan, you will need to have your provider obtain a new authorization under Horizon. That's because that's a different carrier than Horizon. So it's just that is applicable only for the Garden State Health Plan members. But again, if you're somebody who's already in a 10, 15, or the educators plan under Horizon, it's seamless. It happens behind the scenes, but we definitely need to know about this so we can make that happen for you. Please reach out to our office. We do have the 2024 plan options comparisons on the portal right now. So you're able to go ahead and actually do a comparison of all 4 plans against one another side by side to see which one would work best. So I highly encourage you to utilize the comparison tool on the IMAC benefits portal. And another question that we get a lot is, why is there a savings in the educators or the Garden State Health Plan? And I put together this graphic, which I think illustrates that point directly. If you're someone who's in the Direct Access 10 or 15 plan, they take into account for your contribution calculation, the coverage tier, which is if you're covering a family, single, parent, child, or 2 adults, your salary, as well as the premium of the plan. So those 3 are factored into that calculation using what's called Chapter 78. Under the educators or the Garden State Health Plan, however, they utilize just your coverage tier and your salary. So the premium of the plan, even though it increases most every year, is not factored into that calculation, which is why there's a guaranteed savings for people that are moving from Direct 10 or Direct 15 into the educators or Garden State Health Plan. There are plan differences, and that's something we're going to be focusing on heavily today, but this is why you have a savings moving into either of those 2 plans. And there are tables that are different tables, Chapter 44 tables, which are here for the educators plan and here for the Garden State Health Plan. And these are what are used to determine your contribution amounts. So for example, in the educators plan, if you're someone who, let's say, earns $75,000 and you have a family plan, that'll cost you 5.5% of your salary. So you would take that annualized number, divide it amongst 20 pay periods for most of you, which because you're teachers, I assume. or you would divide that amongst 24 if you're a 12-month employee. But you'd be paying 5.5% of your salary. So that's where there's a significant savings. And the higher you are salary-wise, the more significant the savings will be. But with that said, we are going to get into here the plan differences and some of the highlights regarding the educators and the Garden State Health Plan. So the Garden State Health Plan and the New Jersey Educators Health Plan, now with the transition to Horizon, use the exact same network. So from an in-network standpoint, it is the same list of providers across all 4 plans that are being offered. That's called the Horizon Managed Care Network. The Garden State Health Plan, however, only has coverage in the state of New Jersey. There is no coverage outside of New Jersey. So for those of you in Mahwah, and I know Mahwah very well, actually, I love that area. I know that some of you live over the border there in Rockland County, or because of the proximity into New York City. That is something that, unfortunately, moving into the Garden State Health Plan, you'd be giving up. So that is a plan that I caution heavily. I know for the most part, most people in your district are either in Direct 10 or in the Educators Plan. I think if there's more than 5 people in the Garden State Health Plan, I'd be very surprised in your district. It's a very restrictive plan outside of New Jersey, and people hate the idea of giving up that national coverage. Contributions, as I said, for the New Jersey Educators Health Plan and the Garden State Health Plan are based on a percentage of salary rather than a percentage of premium. The copays are the same in both of those plans, $10 at your primary care, $15 at a specialist, $125 at the emergency room, which is waived if you're admitted into the hospital. And under both plans, you do have that gym reimbursement, the Horizon B-Fit gym reimbursement available, really across all 4 plans now. And the 2 main differences that we are going to highlight today with the educators and the Garden State Health Plan is that if you utilize out-of-network providers, those costs will be higher because they're going to be reimbursing less than they are under Direct 10, for example. And the use of a different formulary that has a mandatory generics requirement. So that's important that you know that the 2 big differences amongst the educators plan and the Direct 10, for example, are the out-of-network as well as the prescription plan. Out-of-network, specifically under the educators and the Garden State Health Plan, there are certain dollar limits for certain benefits that are covered at a flat fee. So for example, if you go out of network to an acupuncturist under the Educators or Garden State Health Plan, that's limited to no more than $60 a visit. So if your acupuncturist bills you $100, Horizon's only going to reimburse you back $60, and that's it. There's nothing more that they're going to reimburse with regards to that. Same thing with physical therapy. The reimbursement is up to $52, and chiropractic is limited to 30 sessions and up to $35. So again, this is specific to out-of-network for these 3 coverages under the Garden State and the Educators Plan. So it's important that we highlight that to you so you understand that that's how out-of-network works for these benefits, but we're going to get into more detail about how other services out-of-network function as well. So just as a side-by-side comparison, we did a couple of high-level benefit questions here that we get a lot. So the network in New Jersey, again, it's the Horizon Managed Care Network, New Jersey. Outside of New Jersey, the Direct 10, 15, and the Educators Plan use the Blue Card PPO network. But again, the Garden State Health Plan, only coverage in New Jersey. So there is no national coverage. I know that's important. We were talking in the beginning of the meeting of some teachers that travel to Florida. It's especially important if you have students, dependent children that are students outside of the state, because if you're in the Garden State Health Plan, they will not have coverage outside of the state. But under Direct 10, 15, and the educators, there is national coverage. Your co-pays vary slightly for your primary care between either $10 under Direct 10 Educators or Garden State and $15 under the Direct 15. Your specialist co-pays again also vary a little, $10 under the Direct 10 plan and $15 across the other 3 plans. Your annual well visits are covered in network with no co-pay at all. And your annual deductible is $0 in network, which is great across all 4 plans. Depending on the plan that you choose, there are different limits for out of network, whether it's single coverage or family coverage. Your out-of-pocket maximum, which is the most that you would lay out in a calendar year, also has limits in the network and outside of the network. So again, depending whether you are an individual or family. There are no referrals required under any of the plans that are being offered, so that's pretty terrific. Lab work, x-rays, blood work, MRIs, that's all covered 100% in network. Your labs are LabCorp and Quest. MRIs, for example, I do like to highlight, they do require what's called prior authorization, and that's the same as it is now. So that's important to note. If you do decide to go out of network for any lab work or MRIs, you would be subjected to your applicable copay and coinsurance percentage. Same thing in outpatient surgery, that's covered 100% in network. Out of the network, you're subject to your applicable deductible and coinsurance. And your emergency room copays vary depending on the plan that you choose. So in Direct 10, for example, it is a $25 copay, but in the educator's plan, it is a $125 copay. But in either scenario, if you are admitted into the hospital, that copay is waived. And then an inpatient admission into a hospital and network is covered at 100%. So when we talk about out of network under the educators and the Garden State Health Plan, we are talking about the differences between that against the Direct 10. So in the Direct 10, for example, your out of network benefits are 80%. They utilize what's called the Table of Fair Health, and that's what determines what those out of network doctors get reimbursed back. Under the educators plan, however, they utilize the Medicare table and it's 70%. So it's lesser of a percentage. Plus, it's a completely different table that if you have any parents or family members that are in Medicare, the reimbursements are much lesser for out-of-network providers than they are compared to Direct 10 and Direct 15. What I tell people is that when you're making a decision to switch into the educator's plan, it's important to note how you're utilizing your benefits now. If you are somebody who goes out of network very frequently, that is a complete red flag that I will definitely make sure that I would make sure that you take a look at, because you are going to have a guaranteed savings, but it may be eaten away by the higher out-of-pocket costs that you may face if you're going out of network with that degree of frequency. So for example, if you go out of network in this illustration that we have here, an out-of-network provider, let's say, bills you $100. Horizon takes a look at that and determines, well, if that would have been in network and based on the location of that doctor and the service code that they supplied, that visit should have been $50. Horizon's going to pay coinsurance of 70% based on the $50, which is $35. You as the member are going to pay your 30% in coinsurance, which is $15, and that accrues towards maximum out of pocket. But that other $50 here in that red box that we haven't even touched upon, that is what is known as balance billing. That would be your responsibility to pay the doctor to make his $100 bill paid in full. So again, within the educator's plan, you're going to, or the Garden State Health Plan, you're going to be getting less money reimbursed back from Horizon, making your out-of-pocket costs higher when you're going to out-of-network providers. So that is something that we definitely want to make sure that you are fully aware of. If you would like to discuss this further, definitely give our office a call. I've been fielding calls like this all month. It's important that people understand how out-of-network functions, so you enroll in the plan that works best for you. Bennett card is going to continue to be your prescription carrier. That is not changing. And again, depending on the medical plan that you choose, that's what's going to determine the prescription plan that you'll be enrolled in. This came up when we had our in-person meeting earlier this week. We had a member there that wanted to go ahead and switch into the educator's plan. She did not realize that that would also impact her prescription coverage. So it's important to note that medical and prescription go hand in hand. And if you make a medical side switch to the educator's plan, you will be going into the medical side, to the prescription side of the educator's plan for your prescription coverage. That prescription plan under the educators or the Garden State Health Plan, because they're both the same in prescription world, it has a different list of drugs that are covered. It also has more restrictions as far as the drugs that they will cover, and has a mandatory generics requirement. So if you are somebody who's, let's say, on Lipitor and you want the brand, the educator's plan, because there is a lower cost generic option available, which is atorvastatin, that's what's going to be covered. If you wanted to get the Lipitor, you as the member, because of that lower cost generic option available, you would be subjected to pay for that entire cost of the medication on your own. If a medication is completely excluded, that means that there is no coverage for it. So it's important to note that there will always be a drug for every single condition that's out there, but it may not be the one that you and or your provider want. And that's important to take a look at what current medications you and or your family are on to see if they're brand versus generic. And if you are on a brand that has a lower cost generic option and want to continue to stay on that brand, that's another red flag that I would highlight to make sure that you figure out, hey, I'm going to be saving enough. Will that cover the cost of the medication? So again, these are important conversations to have now during open enrollment. So come January, when you're in this plan for the rest of 2025, that you are in a plan that's going to work for you. Under the educators plan, your co-pays would be $5 for generics. There are certain brands that are covered, and they would be covered at a $10 copay, but non-preferred brands, which usually are drugs that have a lower cost option available, those really are the responsibility of the member to pay in full if you choose to take those drugs. So again, it's important to see how you're utilizing your prescription to see if the educators or the Garden State Health Plan are going to work for you. So next steps. If you are not making any plan changes and you're happy with where you are, you actually have no action to take because we will just take the information that is on Benefit Solver and enroll you in the Horizon equivalent of that plan. However, if you are going to be making a change, you can do that before October 31st on Benefit Solver or by November 15th on that Horizon enrollment form. And if you are waiving your coverage, you do have to complete a waiver form. But in either scenario, you would be returning those forms back to Nicole, again, by November 15th. But we highly encourage you to utilize the IMAC portal to go ahead and do plan comparisons. We have the 2025 contribution calculator on the portal right now, which I know has been a very popular tool that members are checking what their medical plan under Direct 10 is going to look like contribution-wise come January, and what their educators plan would be if they switched into that come January. So that's a great tool that's available for you to go ahead and use that on the IMAC benefits portal. We also have a link there to do a search for providers especially if you're somebody that's coming from the Aetna side, because again, in the state you have Aetna and Horizon. So if you're coming from the Aetna network, definitely take a look at those participating providers. But again, if you're in Direct 10 now under Horizon and you're moving to the educators plan, same network of doctors. Again, this is your open enrollment opportunity for the entirety of 2025. You'll have your next open enrollment opportunity next October for an effective January 1st, 2026 date. And again, those forms need to go back if you are making any changes to Nicole Sweeney at nsweeney@mahwah.k12.nj.us by November 15th. That is a hard deadline, so please make sure that you adhere to it. The IMAC benefits portal that we've been talking about and referencing quite a bit during this webinar is at imacbenefits.com. You do have to enter in a guest key, which is Mahwah BOE with no space, capital M, capital BOE. Everything that we've presented today, including a copy of this presentation and later on a recording of this once we have the link, is on the portal now. So please make sure that you if you need access to that form or you want to do those plan comparisons or you want to look at the calculator, that's all on the portal right now for you. And segueing into that, this is what the calculator looks like. You do need to have Excel 2013 or later in order to use the calculator. It will not work with Google Sheets, unfortunately. But if you don't have access to Excel or you can't figure out how to download it, call us. We will run those numbers for you. I know that on Monday when we were there in person, we definitely ran the numbers for a few of the employees that stopped by. So you would just pick which class of employee you fall under, whether you're a 10-month teacher or a administrator. So again, just choose the appropriate link here on the calculator and you can use that calculator for you. So while we understand that this is your open enrollment opportunity, we know that life happens outside of open enrollment. And you will have 30 days to make any changes if you have a qualifying life event, 60 days if it's a newborn, and coverage is retroactive back to the date of the event. So if you get married, let's say February 1st, you have until March 2nd, because again, 30 days, to go ahead and make those changes and submit that to the Human Resources Office or the Business Office to go ahead and make those changes outside of open enrollment. But again, open enrollment takes place every October for an effective January 1st date. For those of you that have dependent children that may be aging out, they are covered until the end of the year in which they turn 26. At the end of the year, that child may have the following coverage options offered to them. They will be offered COBRA, and that is standard for any of the coverages that they lose. If they if they meet the criteria, they may be qualified for something called Chapter 375 or Dependent 31, which we have a slide coming up about that next. And if you have a child that is overage, that has that is disabled or special needs, there is also coverage continuation for them. For those of you that currently have children that are in either Dependent 31 coverage or in overage dependent coverage continuation for children with special needs, if you currently have them enrolled in the state, we said this earlier, but it's worth repeating, you do have to complete enrollment again for them under Horizon now with the change into Horizon Direct. So again, if you don't know what to do or you can't find the form, please feel free to give us a call. We will walk you through the process of what needs to be done. But it's very important that if you have somebody who's currently enrolled in this, that you change their enrollment now to Horizon Direct. So for those of you that have dependent children that have no children of their own, are not married, live in the state of New Jersey, or are a full-time student outside of the state, and are not entitled to any other group coverage, they may qualify for what's called Chapter 375, which is a New Jersey state mandate. It's only for prescription and for medical. We highlight this during open enrollment because it is a much less expensive option than COBRA. The rates for Chapter 375 would be 60.8% of your single rate for the plan that you are currently in. And the overage dependent would be billed directly by Horizon for those benefits from Horizon and from BeneCard, because you have your prescription with BeneCard and your medical with Horizon come January. So it's important to note that if this is an option that would work for your overage dependent, take advantage of it because, like I said, it is much less expensive than COBRA, which is 102%, by the way. We do have a link on the portal about this, so I highly encourage you to take a look at that if this is applicable to you. We also have on the portal a link for the Horizon Doctor Finder. So again, if you're currently in Direct 10, Direct 15, or the Educators Plan under the Horizon side of it in the state, it's the same network of doctors. And now come January, all 4 plans that are going to be offered do use the Horizon Managed Care Network. But if you have a new provider that you're considering going to and you wanted to search to see if they were in the network or not, you would go to horizonblue.com/Doctor Finder to do that search for providers, hospitals, even urgent care. So any type of health provider service. The Horizon B-Fit is the gym reimbursement that you currently have available in the state. You will continue to have that now that you'll be with Horizon Direct, and this is available to anyone in any of the 4 plans that are being offered. You would just have to go to the gym 12 days or more a month or do your 10,000 steps a day. And for more information and to enroll in this, you would need to go to Horizon B, just the letter B, fit.com. Horizon also offers its members a whole host of discounts called the Blue 365 deals. So if you were interested in getting these weekly emails, you would go to blue365deals.com to sign up as a Horizon member. And they offer some pretty great discounts on things like LASIK eye vision surgery, meal delivery services, Skechers sneakers, gym memberships. So I would highly encourage you as a Horizon member to take advantage of that. Horizon also has an app that we like to mention during open enrollment. It's pretty terrific, especially if you're on the go and you forget your ID card. You can actually have a copy of it right on your phone through Horizon's app. With that said, that really brings us to the end of our presentation. I'm not sure if anyone has any questions. Julie, is there anything that you'd like to add before we wrap up? But before you get into that, Julie, hard deadline of November 15th to make any of those final changes. And I'm going to go back to the ID card slide. Make sure that everyone, and I mean everyone in the district, irregardless of a plan change, because of the move to Horizon, you're getting new ID cards. Highly, highly important that you present that come January 1st. Julie, go ahead.
Yeah, I don't have anything to add, Liz. Thank you.
Awesome. Anyone
Excuse me,
else? Yes,
quick,
yes, please.
Yeah, I have a quick question. Doesn't the insurance offer something for preventative care? So, for example, if you get a mammogram, a colonoscopy, do they give a gift card back once you meet a certain amount of points or something?
That's called NJ Well, and that is something that's only offered in the state health benefits. Now that you're moving to Horizon, that's not something that Horizon Direct offers. That's only in the state health benefits.
Okay, so none of the plans have that. All four of them, they don't have it.
No, because that's
Okay.
only to state health benefits members.
Okay, thank you.
Okay. Yes, Maria.
Hold on, I need to unmute my microphone. So I'm going back to the prescriptions again, and I'm sorry.
Yes, no, I'll go back to that slide.
Okay, great. So, so the list that you sent me, right? The name is there as the recommended generic. That's great. I pay the whatever it is, the $5, and I get it. That's no problem. Okay. Now, how about if the medication is in the non-preferred or it's not on the list at all? Is that when I pay the full cost of the medication, or do I pay a higher copayment? I didn't understand that part.
The answer is if it's listed, especially in that non-covered or non-preferred, either of those two columns, they're not covered. So when you have a drug that is not covered, that means that you as the member are paying the entire cost of the medication. There are
So the medication could be, let's say, $50, $100. And how do I find out the cost of the medication? In the pharmacy?
Yes, costs of medications vary from pharmacy to pharmacy. You'd be surprised how much it varies. I know Amazon, which I know a lot of us use for, personal stuff. Amazon now has its own pharmacy as well. So that's another avenue that you can shop for prescriptions on there if it's a drug that's not covered. But under the educators plan or the Garden State Health Plan, you have your $5 copay for generic drugs, $10 for preferred name brands. But if it falls under non-preferred or not covered, that means that you're paying the entire cost of that medication. And again, depending on where you go, that cost can vary.
Okay. Okay. That sounds good.
Perfect.
I want to take a picture.
And just so everyone knows, the list that Maria is talking about is the performance formulary list that we have on the portal right now. That is the list that Benecard provides as the covered drugs for the educators or Garden State Health Plan. So again, the educators on the Garden State Health Plan, they use a different list of covered drugs than the ones in Direct 10 and Direct 15. So it's important to note if you are considering moving into that plan that you understand the differences with prescription as well.
So we got to go medicine by medicine. Okay, thank you.
Great. I want to thank everybody for their time today. Again, please make sure that you adhere to that November 15th deadline, that you're presenting those new ID cards come January 1st. Double check them when they arrive in the mail in late December. Make sure you're checking them to make sure that they're accurate with your plan and your coverage tier and your name correctly on there. But if you have any other questions, feel free to reach out to our office. Again, our number is 973-450-9800, or you can send us an email at info@imacagency.com. Thank you so much for your time today. Have a great rest of your day, everyone.
Thank you. Bye.
Thank you.
Bye.